In this video, we will discuss about Cytomegalo virus, Herpes viridae, which has been divided into three subfamilies. Three subfamilies: alpha, beta, and gamma. Example of alpha subfamily: Herpes simplex 1, Herpes simplex virus 2, Epstein-Barr virus. Then beta virus, example Cytomegalo virus, gamma virus, varicella zoster. In this video, we will discuss about beta virus, Cytomegalo virus. What is Cytomegalo virus? That morphology is similar to Epstein-Barr virus. Size 100 to 200 nanometer, safe irregular, symmetry isosahedral symmetry with 162 capsomer. Then genome double stranded DNA envelope is presented. It have special structure, name is called tegument. It having tegument membrane is present. So morphology is both Epstein-Barr virus and Cytomegalo virus, both are similar only. Now we'll discuss about Cytomegalo virus. What is Cytomegalo virus? Cytomegalo virus is the largest virus in the herpes virus family, being 150 to 200 nanometer in size. Teratogen. Here we are using one term, teratogen. What is teratogen? Teratogen is any agent that causes an abnormality following fetal exposure during pregnancy. That means the female affected with the cytomegalovirus, she will be fine, no problem to that woman, but it causes damage to fetus. This virus transmitted through placenta, developing abnormalities in that uterus. It causes fetal abnormalities. That agent will causes fetal growth abnormalities. Those agents are called teratogens. Most agents are biological teratogen. Most of that biological teratogens is herpes virus. Actually, cytomegalovirus also teratogenic virus. That means it will causes developmental abnormalities to the fetus. So it can causes problem to fetus. This virus usually presented in shed in urine, saliva, semen, cervical secretion, tears and breast milk. Even male won't affect. Female also won't affected even though they have viral infection. Male also, female also not affected, but it will causes genetically abnormalities in babies, congenital error babies. So the babies are primary target. This cytomegalovirus mainly affected in fetus only, in children only. It is presented male and female, but don't causes any diseases. It mainly affected children only. Next, pathogenesis. Usually it is transmitted through tablet, tears and saliva, and it enter to the body and it replicates. Primary replication occur and it enter lymph nodes and it causes primary viremia. That means virus in blood. If that woman, that virus infected with that woman through blood, it is migrated to that placenta and affected fetus, causing premature babies formation. It will causes damaging to the developing babies, that will cause mentally retard, retarded baby or blindness in the baby or premature baby or genetically disordered babies due to this cytomegalovirus infection. So it mainly affected uh, babies only. Okay, this one mainly affected babies, so it causes mental retarded babies or blindness in the baby, premature babies, genetically disorder baby due to cytomegalovirus. There may be two type of infection. One is prenatal. These are the condition comes under prenatal. Next one is postnatal infection. Prenatal means during pregnancy itself, vertical transmission. Postnatal means after baby birth through some environmental factor. That means through tablet it will affect children. And also we can see this hepatosplenomegaly, inflammation in liver and spleen, jaundice, then thermocytopenic purpura. Thermocytopenic means decreases platelet count. So due to this decreased platelet count, blood will coagulate within the blood vessels. Then it specifically target with the neural cells of the body. Nerve system highly affected, resulting in the formation of microcephaly and chorioretinitis. Chorioretinitis. That means chorioretinitis means that a baby have very small head and a very small brain. They are mentally retarded. This virus is excreted in urine and saliva. Usually it is asymptomatic at birth, but it may lead to cytomegalic inclusion diseases. That means it damages brain cells of the baby. The infection may occur in two types. One is postnatal, second one is prenatal. Prenatal during pregnancy, vertical transmission. Postnatal means after birth through some external outside contact. Through tablet, the baby got infected. That is called postnatal infection. It occurred by sexual intercourse, blood transfusion, and organal transplantation. Cytomegalovirus will transmit person to person. Clinical disease in adult resembles infection mononucleosis. It may cause hepatitis and pneumonitis. It also causes disseminated infection in immunocompromised individual. What is disseminated infection means spreading all organs. So it leads to multi-organ failure in HIV patient. Can even leads to fatal infection. Postnatal it causes hepatitis, pneumonitis, then disseminated infection, multi-organ failure. Finally, it causes death. Next, laboratory diagnosis. Specimen choice are urine, saliva, breast milk, semen, cervical secretion, and blood leukocytes. When we observe the blood smear of that patient who are infected with cytomegalovirus, we can able to see owled eyes. Owled eyes inclusion bodies are seen. So choices urine, saliva, breast milk, semen, cervical secretion, blood leukocytes. Collected specimen to detected cytomegalovirus. Demonstration of cytomegalovirus. After blood smear, we can observe this owled eye inclusion bodies. What is inclusion bodies here? In case of cytomegalovirus, intranuclear inclusion body, particularly Cowtry type, this type, Cowtry type B, seen in cytomegalovirus. Cowtry type B seen in inclusion bodies. Then virus isolation. This virus, cytomegalovirus, can grow in human fibroblast culture. It replicate slowly. So cytopathic effect. So cytopathic effect may take 2 to 3 weeks. For identification, the culture may stained by immunofluorescence or immunoperoxidase technique using monoclonal antibodies. Then antigen detection, we are using PCR serological test. Cytomegalovirus specific IgM can be detected in the serum by ELISA. Then treatment purpose, we are using Canciclovir we are using. Acyclovir also used for prophylaxis purpose. No vaccines available. Thanks for watching.